I'd like to ask each of you to just start and tell us a little bit about yourselves and why this is so important to you and why you're devoting your lives to helping with mental health illness. And Kay, if I can start with you.
As Kim said, the reason that we are talking about mental illness, my husband and I, is because of the loss of our son, Matthew. You know, he was different from the time he was a toddler. We knew he wasn't like his older siblings, but we just never considered that there was anything really wrong. We just kept thinking that he would grow out of the things that were happening to him, but by the time he was 7, he was clinically depressed. We didn't even know children could be depressed. That's how ignorant we were. We just kept thinking he was sad because we had moved and that he was sad. And so it took us a while to figure out that he really had something wrong. Clinical depression, and then from there, panic disorder. By the time he was 11, he was diagnosed with early onset bipolar. In his teen years, major depression, suicidal ideation, OCD, and when he was 25, 2 years before he passed away, he was diagnosed with borderline personality disorder. And so needless to say, our life was hell. His life was hell. He suffered. He lived in torment. He was incredibly bright and funny and creative and wrote the most amazing stories, and the world lost probably one of its best advocates for vulnerable children. He was passionately concerned about sex trade and the women and men and children who were affected, and broke his heart, very tender-hearted, and the world lost an amazing human being. But Matthew tried, and he tried, and we tried. Every drug, every program, every hospital, anything. I combed the internet. I had these bookshelves, you know, books, and talked to anybody I could talk to, and nothing ever really made a difference. And so at 27, as this drumbeat of mental illness just kept getting louder and louder and louder, he began to be hospitalized as an adult. He made several suicide attempts, each one a little more edging toward the lethal means. And you may or may not know, but he was finally, with a lot of effort, able to purchase an illegal firearm off the internet. And that became the attempt of which he could not recover. And so on April 5th, 2013, our amazing son took his life. And as I've said to many people, we were devastated. The worst day of my life has already happened. But we are determined not to let that be the end of Matthew's story. It's not. He was so much more than a statistic. And we want to do what we can to raise awareness, use our voice for other individuals and families so that they don't walk through this catastrophic loss. And it propelled us. We are compelled to talk about this and to do something of significance.
I'm grateful as an advocate and privileged to be with you here today. My story is a little different. I always had an interest from a relatively young age in disability-related issues. I went to the University of California at Berkeley as an undergraduate that housed the Center for Independent Living, and I saw people with physical disabilities overcome great odds to get college degrees. And I continued with that work and advocacy when I was a law student at UC Davis. And so I've always seen the flip side of disability being ability. And when I was privileged enough to serve on the city council in Sacramento, homelessness was a major controversy. And in fact, my city, the city of Sacramento, ended up suing a major charity for feeding too many people on Sundays. And I voted against it, by the way. It was one of those man bites dog stories where the city was trying to grapple with the overconcentration of homeless people in the downtown area, but went about it, I thought, in the wrong way. But it made national news, and I recognized at the time that what was really happening for so many people was that people who know little about California history know that in the 1960s and 70s, the state made a well-intended public policy decision to shut state mental hospitals and promised at the time that it would fund a system of community-based care and treatment for people so that people living with mental illness could live to the varying degrees of their ability independently and in the community. And it is a promise that for decades was never fulfilled. So around that time, I was running for the Assembly and decided, I don't know if it was a good campaign tactic or not, to make mental health my signature issue when I ran for the legislature. And I was fortunate enough to win. And on my first day, I introduced AB 34, which turned out to be a $10 million investment in what we call integrated services for the homeless mentally ill. And over 6 months, case management, whatever it takes, we showed that for 1,000 people, their lives were much better after getting the services than before they got the services. It was so successful, we upped it to $55 million and continued for years. And then I realized back in 2003 that while we were happy with what we had done, that it was barely the tip of the iceberg. So despite some of my misgivings about California's initiative process, we decided in 2003 to put aside those scruples, if you will, and to go to the ballot. And so I raised the minimum amount of money necessary, and we went on a flyer, really, to the ballot and put Prop 63 before the people of California. And lo and behold, I think for a variety of reasons, it passed with 53% of the vote. And it is, as Kim said earlier, has generated upwards of $1 billion a year. In 2015-16, it's projected to generate $1.8 billion. And Orange County, of course, is a major recipient of that. Now, this is a great news, not so good news story. It's a great news story because it's an unprecedented level of investment in helping thousands of people. And yet the work is far from done because the money rose during the state's Great Recession, and so a lot of the pre-existing services decreased. And there's still so many people who need help. And so I hope what we can discuss here this afternoon, among a lot of other things, is what is it going to take in California and in this country to build a mental health movement that assures that any child that needs help can walk through a front door and it's not the wrong door and get the help that they need. Because our work is far from done, and I look forward to the conversation this afternoon.
How can we better educate people and parents in particular to tune in to issues? So all of us that have kids, we didn't get a manual when we left the hospital. We came home with the baby, and it's a complicated journey. But I would love your thoughts on kind of, as individuals, what should we be looking for? And I'd also at some point like you to talk about the role of the faith community, because both of our speakers here have a lot of thoughts around the different places that people turn when they start to get confused or need help. So would you mind?
Yeah, well, you know, just to point out something that'll probably come up in this conversation is that most people are diagnosed, at least 50% of people who are going to end up with a mental illness are diagnosed before they're 14, or the signs are showing up before they're 14. So to know that if we can intervene at an early age, if we can get children the proper diagnosis, if we can get them in the right care, the right treatment, that it slows down the progression of the disease. And so it has less of a time. I'm not a medical expert. I don't want to pretend to be one. I'm not a mental health expert. I'm a grieving mom who was thrust onto a journey that I didn't ask for, and so I'm learning a lot. And one of the things that I know is that when children are diagnosed properly and treated properly, the progression slows down. So it's so important to grab onto that. And as a parent, as I said, our son was 7 when he was clinically depressed, and it was probably a year before we had him diagnosed because we didn't know that children could experience depression. We thought that was an adult disease, adult disorder. And so I think that pediatricians can play, there's a lot of answers to this, but I think pediatricians can play a very important role for families, because believe me, every mom is in her pediatrician's, I mean the vast majority of moms are in the pediatrician's office, feels like every month, every 2 months, especially in the first year of their child's life, up until kindergarten. They're there all the time. And for pediatricians to be well trained in mental illness and recognizing the signs and asking the questions. I think often pediatricians don't even really know to ask the questions about mental health, about the emotional health of a child. And so if a pediatrician asks the question and the mom or the dad feels like they have the opportunity to have a true conversation more than the 5-minute well baby check, you know, where it's how's he doing, you growing, great, good, see you in a couple of months, that's not enough. That's just not enough to help catch some of the mental health problems that children have. So I see a huge value in upping the training on pediatricians, the nurse practitioners in pediatricians' offices, so that when parents come, there's a very natural place for them to receive information. I mean, blanket the place with flyers and information and resources where parents can go if they find that their children are beginning to struggle. I think that it requires, as they get a little bit older, a lot more than just writing out a prescription for Ritalin and bing, bang, we're done, good, you know, you're good to go. It's so much more than those very brief slots of time where you don't get to ask the question. So I think that's one of the most important ways that we can make a difference in getting children diagnosed and getting parents the education that they need. The faith community, oh goodness, give me 3 hours to talk about this. As Senator and I were talking before we started, the faith community, we like to look at it as crawl, walk, run steps. So there are churches, faith communities, synagogues, mosques that are as big as Saddleback, and some of you might say, well, of course, you're a gigantic church. You've got thousands of people. You must have gazillions of dollars lying around. So of course, you can have an outreach to people who have a mental illness. But really what I want to make sure that you understand as you leave here today is that there is a role for every single faith community, whether it's the size of 15 people or 1,500 or 15,000. There are some things that you can do at a walk step. There was a study by the American, I wrote it down because I want to make sure I quote it. The American Religious Identification Survey was taken in 2008, and they identified that 76% of Americans identified themselves as being Christian, and 4% identified themselves as being Muslim, Jewish, or Buddhist. So that means 80% of Americans, according to that study, identify as having some faith component. They're spread throughout 350,000 faith communities in the United States. So there's plenty of congregations that could be a part of this movement. And another study by NAMI shows that 25% of those who are experiencing a mental health crisis will go to their priest, their pastor, their rabbi, their imam before they will seek out help from a physician. That tells me that the faith community needs to be prepared, and the faith community needs to do something of concrete importance. These are these 6 little steps I'm going to give you really quick. If you're taking notes, you know, you should take notes at everything because somebody's always got something to say. The brightest people in the room always take notes. So let me just give you this little... I'm just saying.
Duly noted.
No pressure. But it's built along the acrostic church, because this is my faith community, this is where I come from. Every church, whether you got 5 people or 500, can make a decision to care for and support people who are living with mental illness. It doesn't cost any money to care. It doesn't cost any money to have compassion. It doesn't cost any money to decide that you're going to be somebody who cares for people who have mental illness. Every single faith community can make that decision. Every faith community can decide to help, that's the H if you're taking notes, with practical needs. When I was diagnosed with cancer many years ago, people brought me casseroles. They took me to my doctor's appointment. Mental illness is the no casserole illness. Nobody wants to help you if you just got a diagnosis of bipolar or borderline or schizophrenia or major depression. We can change that. Every church can help with practical needs. Every church is full of volunteers. We can unleash volunteers. It's a built-in, ready-made group of volunteers. Every organization, if you're part of an organization, who are you always looking for? Volunteers. Faith communities, Got them in droves. The R is to remove the stigma. Again, it doesn't cost a penny to remove the stigma, to take down, to knock down those barriers. One of the main reasons people don't go to get help is because of the stigma. I just spoke in a church in South Carolina on Sunday. I can't tell you the number of people who whispered in my ear. They couldn't say it out loud, but they whispered in my ear, I have bipolar. I have depression. I have major depression. And I wanted to say to them, say it loud. Say it loud, because if you don't say it loud, everybody's going to continue to treat it as a stigmatizing illness. The second C is to collaborate with community partners, like we're doing. And then the H in church, as you're taking notes and wrapping up your acrostic, is to offer hope. Listen, the faith community can offer hope like nobody else. The government, they're not in the business of hope. You know, professional organizations, not in the business. Sorry. Well,
no,
sorry.
I agree. I agree.
Except for Prop 63.
No. I want to. Can I pick up on that?
Absolutely, please.
Because I was just going to say, and I hadn't really thought of it in this way until really listening to you closely, but the role of the faith community in helping people live with mental illness is absolutely essential. Because frankly, and I say this as someone who's spent his life believing that government can and often is a force for good for people, but we cannot rely on government to fund this system in a way that's going to be responsive to everybody's needs. We just can't. And so what does that mean? That means, as Ms. Warren said, the places where people congregate, the people where they feel comfortable, the places where people feel welcomed, where they can be vulnerable, are the places that must be proactive in responding to this crisis. I absolutely agree with you. Now, government plays a role because I think it's the combination of upping our commitment on the public side together with the private side and the faith-based side that can really, I keep saying, build a movement, and I mean that, build a movement where people can get help and where we end the stereotype and the reality that, oh, this is such a broken system. It doesn't have to be that way.
I'm going to ask you to talk a little bit more about funding, because when we started thinking about it at CHOC, it's like, oh my gosh, there's not enough money. So the funding and how it's contributed to a fragmented or maybe not even adequate infrastructure, and your thoughts. I'm going to have government offer some hope.
Sure. But let me step back for a moment and talk about why I think mental health has been underfunded for so long, despite Proposition 63. I think there are three indisputable facts. Number one, these issues are pervasive. They know none of the usual artificial boundaries that divide us. It is certainly not a Democratic issue or a Republican issue. It's not a class issue. It's not a racial or gender or ethnic issue. It knows no geographical boundaries. These issues affect everyone. I didn't tell this in my introduction, but we've been public about it. After I became an advocate, we lived with this issue in my family as well, with my now 21-year-old daughter, who suffered from childhood bipolar disorder, and we had years of residential treatment and struggles, and we had no idea what the outcome would be. Thank God she's doing well now, and with some struggles is on her way. But a day has not gone by in my life since she published her story back in August of last year that people don't approach me on the street, people I know, people I don't know, who tell me their stories. This is pervasive, whether we talk about it or not. Second indisputable fact. This issue affects most of the major public policy issues that we ask representative government to grapple with, expensively and often ineffectively. Criminal justice, homelessness, the overtaxing of emergency rooms as the first resort to try to help people, the plight of veterans, on the kids who fall behind in school because they're not diagnosed properly and not treated. That's fact two. Fact three, with rare exceptions, and despite facts 1 and 2, there are very few political leaders or civic leaders, frankly, who choose to make this issue a priority. When was the last time you heard a governor or a president talk about the need to build a better mental health system? Or a legislative leader? Or when have you seen mental health be a top-tier priority issue when it comes to state or national budgets? In the wake of the terrible tragedy in Sandy Hook a couple of years ago, the federal government made a big deal out of a $100 million investment in mental health. We're doing 1.8 in California through the Mental Health Services Act. So somehow we need to reduce the chasm between its pervasiveness and the fact that people don't pay attention. Now, I'll stop in a sec, but I think it's important to analyze why political leaders don't take this on. And I think it is that word that Kay used a moment ago. It's the stigma issue. People are afraid to talk about this. One, because in many cases, I know many elected officials who either live with this or have family members who it's too close for them to want to take it on. They'd rather work on climate change because that's not as painful or as personal. But there's a second reason which I think we must acknowledge, and that is people associate mental illness with failure. And that's where the telling of the stories of tragedies, of course, but also the stories of success must be told. The stories of recovery, the stories of people who get better, the stories of redemption. And those of us who believe that government can make a difference ought to be focused on publishing outcome-based, data-based evaluations to show the positive outcome of these investments. And we haven't done a good enough job in doing that. That's how we cultivate public leadership and civic leadership, to say investing in services means more success than not, and that failure is not the only thing associated with mental illness. Thank you.
Darrell Steinberg for president.
Okay, thank
Yeah, there we go.
you. Thank you.
We're
You're
adjourned.
sweet. You're sweet.
And I think you're both really touching on really important components of this initiative. And if we can identify people in our communities early on, and Kay mentioned, I know we all heard it, that 50% of adults living with mental illness had symptoms before they were 14 years old. And if we caught that early on and we could make a difference, I have no doubt that the outcomes data is going to be very compelling in terms of how we can improve lives. So
can I just yeah. Again, concurring, it takes collaboration. There is a role for government. There are things that only the government can do. There are things that only the medical community can do. But there are things that only the faith community can do. And as Kim said, there's not any one particular entity or domain or sector of society that can tackle this alone. It requires collaboration. It requires a unity of thought and purpose. It requires politicians, pastors, educators, physicians, family members, those who are living with mental illness. It requires a coalition, if you will, that is determined. We were talking beforehand. I was saying that for years I've been an HIV and AIDS advocate, and I was comparing mental illness to the way that HIV has been funded in the United States. And part of the reason that HIV has been funded is because there were activists. There were people who were willing to throw paint, who were willing to lie down in the middle and stop traffic. There were people who were willing with bullhorns to scream and yell and get something done. And there are very few people in the mental health world who are willing to be that vocal, that radical, to be that loud, and who are willing to expose themselves to public ridicule, if you will, for being so passionate. But I think that you can tell that we are passionate about this. We can all probably froth at the mouth a little about it, and that's okay. Frothing at the mouth is a good thing for this. It's the only thing that's going to make it change.
Our responsibility is to make sure that we are not shy and quiet about telling policymakers and editorial writers and others that there are answers and solutions to improving mental health outcomes, especially for young people. That's what I think you ought to do.
Thank you. Kay.
Okay, so, you know, Hillary Clinton wrote a book a few years ago called It Takes a Village.
And she was widely ridiculed by a lot of people for that. And I probably would have joined that too, except for I've been in villages around the world, and I've seen the difference it makes when a village takes a responsibility for its people and its children. Let's start here. Yes, the children of California matter. Yes, the children of the United States, the children of the world matter, but let's start in Orange County, taking ownership of these are our children. They may not be your biological child, but they are our children, and we can do better for them than we have so far. We can make life better for them. We can take what's already provided. We can connect them, but it starts with a decision. And a decision is something you have to do as an individual. When we're calling for rallying or we're calling for coalition, it takes people who make a decision to say, yes, I will do better for the children in Orange County. It's not good enough what we've done so far. We can do better.
Thank you both. All right.